Well, I live in far northern Wisconsin, very rural, and suspected that getting a Medicare for All resolution passed in rural counties was next to impossible, if not absolutely impossible. Monica Barrier, John Calabrese, and then Lorene Vedder, a group of seasoned activists, we decided on Dunn County.
The county board has 29 members, and we have the authority to place a referendum on the ballot, but it needs to be voted on. We had a shot of doing this, but that it was going to be hard.
What occurred to me and some others after we discussed it was that a neutral advisory referendum question, in plain language, descriptive language that avoided any political polarization, might get through a county board using the argument that it was an issue of sufficient magnitude in people's lives to warrant letting people speak on it.
Shall Congress and the President of the United States
enact into law the creation
of a publicly financed non-profit
National Health Insurance Program
that would fully cover medical care costs
for all Americans?
We developed three main lines of argument. One was the cost to the county.
I want to look at this from the perspective of the county's budget. The county has spent around $500,000, and that's $500,000 each month on health insurance. And I believe that as elected officials and stewards of taxpayer dollars, we have a responsibility to demand better of the federal government that serves us. It was a huge motivating factor for the board. It just so happened that the night that the county board was voting on it, the director of the Health and Human Services Department was presenting her annual report. One of the more conservative members of the board raised his hand and asked a question. If a national health insurance program were passed, would that have a positive impact on your operations and your budget? And the director of Human Services said, well, it's hard to see how this wouldn't make a positive impact.
The second argument was made quite well by Lorene Vedder's husband, Michael Brandt, who made a strong case that the American people no longer trust their federal or state governments, but still have some faith in local governments because they're local.
Government is by the consent of the people. The people have been pushed out of government quite a bit, except in local, small community government. This is real government. If you put a referendum out, you're giving a voice to the people.
And then there were a half a dozen people that spoke out their personal experiences with the health insurance and the healthcare system.
A group called Community Conversations, to help us find the people that were fairly prominent in the community, and that helped.
We tried to discourage people from using the phrase single payer, Medicare for all. We learned early on that talking about the health insurance or healthcare systems of other countries was not a good idea. Keeping it local, personal.
I want to speak about my son, who is a small business owner.
I am a retired physician.
In my mind, universal health care could be a money savings plan for our city and state workers.
It's time to do the right thing.
Those in the audience who support having this referendum on the ballot, would you please stand up?
And I'm going to call the vote. All those in favor signify by saying aye.
Aye.
Opposed? Unless my hearing went to heck, it passed.
Apparently it resonated with them. They approved placing the referendum on the ballot unanimously.
I was absolutely stunned. The county clerk walked through the middle of us after the vote with the biggest grin I've ever seen on anybody and said, "Good work, folks." He was a fan of what we were doing.
out in Ridgeland, Wisconsin this morning. It's like that in Downing, Wisconsin today. Just like that guy. This historic referendum is about shifting the conversation. Vote yes.
We were able to go out in the street corner for events and talk to people as they went by and give them information on the referendum, so they were fairly well educated. We had some really good initiatives like getting involved with the university.
I just spent about 20 minutes talking to a fellow up in Cedar Falls. I just talked to Ken, and I gave him the flyer. As I go around talking about health insurance, not a single person has said to me in this red county that went for Donald Trump twice, no one has said, you know, our health insurance system is great. And herein lies the answer to our division. We focus on the issues.
We got a very positive response.
Well, I was so encouraged, my interactions with people about it.
I gave some speeches at meetings. John Calabrese gave some speeches also. It was really well received.
Our plan was to start in trailer parks in Dunn County. After we exhausted the ones in Menominee, where I live, we started to go out to the village of Colfax and Wheeler and Elk Mound. While we were spending days there, we figured we might as well do as much of the rest of those villages as we could. The referendum passed. The results are in Dunn County, Wisconsin, and we won. People voted in favor of a national health insurance program in a rural Wisconsin county that went for Trump.
And everybody wanted to know immediately, how did you get a county with that slant to agree to a publicly financed nonprofit national health insurance program? The answer is we went out and talked to them about it.
Our national health insurance referendum passed in a rural, conservative-leaning, red county in the middle of America.
The referendum outcompeted the Democrat candidates.
And so the townships where we didn't get to, the numbers on the referendum were tracking in line with Republican versus Democrat. But in the villages where we spent a few days dropping literature everywhere we could, talking to people, we actually won in those villages.
So there were definitely a large number of Republicans across the county who voted in favor of the referendum.
And I think the value of this project is that it seems to have inspired people all over the country. It was published in Common Dreams, at The Intercept, regional print, statewide media.
Set out kind of a roadmap for how we did this, trying to inspire people in other counties to do the same.
How we talked about it and how the question was worded really got through to people.
This formula gives people anywhere a viable chance at success in their particular county. This is about changing the conversation.
Especially in these rural, conservative-leaning counties, we can pass it there, talk to people authentically, face-to-face, then there could be a day when we realize it. We have health insurance for everyone.